Hello everybody and welcome to the Tuesday edition of Video Clips. First of all, some announcements. The Diet Lifestyle course starts June 2nd or 3rd, something like that. First Wednesday in June is when it starts. And this is the incredible class we offer once a year with instructors like Dr. Caldwell Esselstyn, Dr. Neil Barnard, Dr. Alan Goldhammer, Dr. Ralph Moss. I mean, the list goes on, but it's all of the fabulous experts in their respective fields that you hear me talking about all the time and who you've had a chance to listen to at our conferences. And we have 3 more classes starting this semester at the Institute. That would be Women's Health, Dietary Supplements, and Business Training for Health Professionals. You can still enroll in those. Topic for this month's advanced study is thyroid disorders, and a lot of that going around, a lot of misunderstanding about it, so that may be something that you want to consider. And we're doing a lot of free workshops for both consumers who are interested in our model of healthcare and healthcare providers who are interested in having us teach them how to do this either on their own or with us. So if you like the kinds of things you're hearing me talk about here and you want to explore how you might get involved with us, we'll give you some free opportunities to do that. So send me an email at pampopper@msn.com if any of the stuff is interesting to you, and I will get you the right information about how to proceed and get more information. Okay? All right. I want to talk about fibromyalgia. According to a leading expert on fibromyalgia, non-pharmacological approaches to fibromyalgia should be offered and are more effective than drugs. Dr. Winfried Hauser said that, quote, "There is no magic drug against fibromyalgia, and in my opinion, there never will be." Interesting statement, since every 20 minutes we see medications advertised on television for fibromyalgia. This doctor says that psychotherapy can help and in some cases turn patients into former patients. He also suggests exercise. He said it's the most effective weapon we have, and not only do healthy people benefit from exercise, but people with fibromyalgia do too. And it's unfortunate, but a lot of people with fibromyalgia don't exercise because they're in pain, and they're often told not to by, I'm sure, well-meaning doctors, but as it turns out, not such great advice. Dr. Hauser presented a summary of research findings on treatment for fibromyalgia at a rheumatism congress in 2014 in Europe. He says there are a few studies that have compared drug and non-drug approaches to treating fibromyalgia, which makes it difficult to determine what is the best thing to do. So to address this, he and his colleagues conducted a meta-analysis that was an indirect comparison of all the available therapies. And what they found is that there is no advantage to getting drug treatment versus getting other types of therapies that don't involve pharmacology. Well, since there are always negative side effects to drugs, and since in the case of fibromyalgia they're proven to make no difference at all, I think that's a pretty strong argument for looking at other ways to address the issue, including diet and exercise. Hauser stressed the importance of considering the individual when making treatment recommendations, and says, rightly so, that a lot of times clinical trials that have looked at drugs aren't representative of individual patients. And that's true not just with fibromyalgia, but with so many other drugs as well, because the studies are done on perfect patients who don't have a lot of things wrong with them and aren't taking multiple drugs, which is not always the case in terms of the types of patients who walk into doctors' offices. The drug studies basically showed, though, no benefit. Hauser cited a cross-sectional survey of patients, and I thought this was really interesting. They asked them to list the top 10 most beneficial treatments for fibromyalgia. None of the 10 were drugs. They also asked to list the 10 most harmful therapies, and guess what those were? All of them were drugs, all right? So fibromyalgia patients themselves report that the drugs are useless. Dr. Marianne Fitzcharles, a rheumatologist at McGill University, agrees that drugs are not the best option and says that exercise, promoting an internal locus of control, that's a term that Dr. Esselstyn uses. The patient's in charge, the patient gets good information, takes control of the situation, and education. She says those are the best options, and Hauser agrees and says we should be cautious about over-medicating patients and keeping them on continued medications. We worry about the side effects. Non-pharmacologic therapies have no risks. Amen. All right? So if you have fibromyalgia, don't take the drugs. They don't work. Anything else would be better because they don't work. All right. Another thing that doesn't work. According to a recent randomized placebo-controlled trial looking at the efficacy of acetaminophen, that would be drugs like Tylenol and Excedrin for low back pain, the drugs are useless. does not relieve pain, improve the speed of healing, or positively impact any factor associated with low back pain. And those factors include disability, function, global symptoms change, sleep quality, or quality of life. Now, it's the first trial of this type, and lead author Christopher Williams said, "These results suggest we need to reconsider the universal recommendation to provide these drugs as a first-line treatment for low back pain." All right, so the study involved 1,652 patients with acute low back pain who were randomly assigned to receive Tylenol or acetaminophen, some version of it, 3 times a day, as needed doses of acetaminophen or placebo. The median time for recovery from low back pain was 17 days in the group that took acetaminophen 3 times a day or took it as needed. Actually fewer days, 16 days in the placebo group. Essentially, no difference. Researchers concluded that, quote, advice and reassurance other than analgesics should be the focus of first-line care. In an accompanying editorial, Doctors Coase and Enthoven note that worldwide guidelines recommend acetaminophen as the first-choice treatment for acute low back pain, a guideline that should perhaps be adjusted. Now, this is just an example of how messed up things are in the healthcare world and why consumers need to know this stuff. The first line of treatment, according to international guidelines, are drugs that do not work. Now it gets better. They also note that the next line of treatment, NSAIDs, have been shown to be better than placebo, but the difference was small, that NSAIDs have not been shown to be better than acetaminophen for low back pain, and that there are safety issues with those drugs. We could spend another 20 days talking about the safety issues with NSAIDs. In other words, drugs are a poor choice for treating back pain, yet they are recommended every day through television advertising, in doctors' offices, and articles about health, and in fact in practice guidelines. So what should you do in the event of low back pain? Well, here are some suggestions: exercise, stretching, yoga, massage, acupuncture, and eating an anti-inflammatory diet. These things work, and they have no negative side effects. And here's another thing: just waiting for the pain to dissipate. The body heals itself, and pain has a way of going away if you just give it a little bit of time. All right, that's all for today. As always, pass this on to anybody who you think might enjoy watching it, and I'll be back to you on Thursday with more news.